welcome. So, I guess your blood group is not news to you because you know that you're AB, you're O, you're whatever, you're A or you're B, right? So, in today's video, would be looking intensively at okay. Okay, so we'll be focusing in today's video on that negative or the positive, whether you're O positive, you're O negative, you're AB, whatever. So that negative and positive, what is it really about, self? First of all, that is called resource factor. So you can either be resource positive or resource negative. It's either it's there or it's not there. Now, antigens are actually substances on the surface of the red cell, right? So it's either this rhesus factor is on the surface of your red cell or it's not there. So if it's on the surface of your red cell, we say you're rhesus positive, and if it's not there, we say you're rhesus negative. How does this apply to us? Now, when you, as a rhesus positive man, get married to a rhesus negative woman, upon the first pregnancy, the first intake, your wife is going to be sensitized, the woman is going to be sensitized, and after carrying the baby is born many times. It doesn't affect in the first pregnancy, but the baby is most likely going to be rhesus positive because daddy's rhesus positive, mommy's rhesus negative. Okay, there's high percent chance that the baby might be rhesus positive, right? So now when a rhesus negative woman carries a rhesus positive baby, over time the antigens from the baby get into mommy's bloodstream, right? And then mommy's cells are like, what is this? They get sensitized. They're like, okay, next time this thing comes, we're going to attack it. This is foreign. This is not us, right? So upon the second pregnancy, we will now have a very big problem, especially when the woman doesn't take any measures to mop up what was already there, like the antigens that were in her system. So what happens this time around? Upon second exposure, that second pregnancy, you realize that the mother's cells begins to attack the baby. Okay, there's something we call the transplacental migration. So this is on a normal day, right? The baby is supposed to get some kind of protection from mama because, okay, you're going to be exposed to the world and there's a lot of viruses and bacteria in the world, right? So there's supposed to be some antibodies from mama to baby, right? So now during this migration from the mommy's blood cell to the baby's blood cell, now these antibodies that the mother must have developed as a result of the sensitization, they enter into the fetus, into the baby, the growing baby in the womb, and they begin to attack the red cells of that baby. Now, this attack, it doesn't end there. It's a very serious thing. And the red cells, the mother cells begin to fight the red cells of the baby, breaking down the red cells, and now the heart of the child will have to work extra hard to compensate because there's no enough oxygen in the baby's bloodstream, which means the baby is suffering from anemia. So the heart tries to pump blood over time. It works faster, it works harder, and over time the child might end up having cardiac arrest while in the womb. That's why you see a lot of stillbirths. So when the red blood cells of the baby are broken down, the liver and the spleen, they are the main organs that are responsible for blood production in babies. So they try to work extra hard and over time to make sure that they compensate for these red blood cells that have been broken down. And they end up producing immature red cells. And these immature red cells are technically useless with the situation on ground, right? And because of this extra workload, the liver and the spleen end up developing hepatomegaly, splenomegaly. They get enlarged and the productivity begins to decline. It begins to go down. So how can all of this be avoided? Because there are a lot of problems on ground. Yeah, we have neurological issues, the kernicterus, the jaundice, we have the high bilirubin, we have the red blood cells, the anemia, the red blood cells being broken down resulting in anemia. There's so much issues. So how can, and then we have, yes, we still have the hepatomegaly and the splenomegaly. So how can we just avoid all of this? there is a shot that is supposed to be given to mama after first exposure, and this is called Rogam. And this is meant to serve as a passive immunization for the mother. And with this Rogam, she can have her other babies without any of all these issues. So you see, with just one solution, one thing that can be done, all of these problems can be taken away. All of these problems can be avoided altogether. So that brings us to the end of today's video. I hope you enjoyed it. So key points to note. Number one is what these antigens are. Remember that they are substances found on the surface of red cells. Number two, know what Rhesus factor is. You have to know that you can either be Rhesus positive or you can be Rhesus negative. Number three, you have to find out before getting married and all that, whether you're positive or negative. If you're positive, if you're a positive man and your wife is negative, of course you can get married, but just do the right thing by taking preventive measures after your first baby, or even when you have your first baby, or your doctor will be able to talk to you and tell you what is to be done. You have to know that Rogam can actually mop up all the IgGs that's produced as a result of exposure to a Rhesus positive baby, and you can have all your babies without any problem. And then the last point to note is to remember all the things that can result if the proper measures are not taken. Remember, it could lead to neurological problems. Remember, it could lead to anemia. Remember, it could lead to hepatomegaly. It could lead to splenomegaly in the baby. Remember that it could lead to cardiac arrest in the baby. And then we're going to be having babies that are born still, like dead. We don't want that, right? So I'll see you in my next video. I hope you enjoyed this one and found it educative. And remember, this is an educational video and shouldn't serve as a medical advice in any way. You should see your doctor and always follow due process, as the life of your baby and your life is very, very important. Thank you so much for watching this video. Please do share, like, and subscribe. I am Oka for Confidence. See you next time.